So good evening. In this session, we will be studying the glossopharyngeal nerve. So if you want to understand the deep nuclear origin of the glossopharyngeal nerve, we'll just revise the functional components of the cranial nerves. Like you can see here, there are 7 functional components. These are the motor and these are the sensory. So you can observe here general somatic efferent, special visceral efferent and general visceral efferent. So if you see general somatic efferent, it is like somato-motor fibers like all the skeletal muscles which will be supplied. Then if you see special visceral efferent, it is branchiomotor fibers which will be supplying the muscles developed from the pharyngeal arches. So general visceral efferent is motor fibers to the viscera. And here you can see general visceral afferent, general sensation from the viscera. Special visceral afferent, special sensations from the viscera like taste, smell, like that. Then if you see general somatic afferent, general somatic afferent, it is like general sensations from the skin like touch, pain, temperature, all those things. Then if you see special somatic afferent like hearing, balance, all those things comes under special somatic afferent. Now let us see what are the cranial nuclei under these 7 functional columns. If you observe general somatic efferent, third cranial nerve, oculomotor nerve, then trochlear nerve, which supplies the muscles of the eyeball. And abducent, again, this also supplies the lateral rectus. Trochlear supplies the superior oblique. Remaining extraocular muscles will be supplied with the oculomotor nerve. And here you can see the 12th cranial nerve, hypoglossal nerve, which supplies the muscles of the tongue. So these are purely motor, general somatic efferent. Then special visceral efferent, branchiomotor. So these nerves supplies the muscles developed from the branchial arches. Like if you see the trigeminal nerve, then facial nerve. So mandibular nerve is the nerve of the first arch, facial nerve is the nerve of the second arch, then glossopharyngeal nerve is the nerve of the third arch. Okay, so like this we have this branchial arch nuclear components, we call them as branchiomotor fibers or special visceral efferent. So then we have general visceral efferent like Edinger-Westphal nucleus, salivatory nucleus, then dorsal nucleus of vagus. All these are general visceral efferent. Then we can see special visceral afferent and general visceral afferent. That means both special sensation and general sensations from the viscera. You can see the nucleus of tractus solitarius. So the general sensation from the tongue as well as taste sensations from the tongue both comes to the nucleus tractus solitarius. And then you can see this is the general somatic afferent. So this is the sensory nucleus of the trigeminal nerve. This is the mesencephalic nucleus in the midbrain. This is the chief sensory nucleus in the pons, and this is the spinal nucleus of the trigeminal nerve. So this component forms the general somatic afferent. And here you can see the special somatic afferent, as I said, hearing and balance, vestibular nuclei and cochlear nuclei, dorsal and ventral cochlear nuclei, the superior, inferior and medial and lateral vestibular nuclei. All these are the different cranial nerve nuclei under different categories of the functional components. Now let us see what are the deep nuclear origins and functional components of the glossopharyngeal nerve in the succeeding slides. As you see, today's topic of interest is the glossopharyngeal nerve, also the 9th cranial nerve. It's a mixed nerve. It has both motor and sensory components. So glossopharyngeal nerve is the post-traumatic branch of the third branchial arch, and the tympanic branch of the glossopharyngeal nerve is the pre-traumatic branch of the second branchial arch. So what is post-traumatic and pre-traumatic? Post-traumatic is the nerve which passes along the cranial border of the pharyngeal arch. The pre-traumatic is the one which passes along the caudal border of the pharyngeal arch. Functional components: branchiomotor fibers, special visceral efferent supplies the stylopharynges, then preganglionic secretomotor fibers supplies the parotid gland, then general somatic sensory fibers, so which receives sensations from the posterior one third of tongue, soft palate, tonsil, oral part of the pharynx. Then special visceral sensory, there is taste sensation from valid papillae, posterior one third of tongue, fauces and palate. Then general visceral sensory, that's why you can see carotid sinus and carotid body, which are present at the termination of the common carotid artery into internal carotid artery and external carotid artery. So carotid sinus acts as a baroreceptor, whereas carotid body acts as a chemoreceptor. So now let us see the nuclear origins with respect to these functional components. So if you see, upper part of the nucleus ambiguous gives rise to brachiomotor fibers which supplies the stylopharyngeus muscle. Then inferior salivatory nucleus forms the preganglionic secretomotor fibers here which supplies the parotid gland. Then upper part of the spinal nucleus of the trigeminal nerve, general somatic sensations. Then upper part of the nucleus of tractus arterius, taste and other visual sensations. Then superficial origin, 3 to 4 rootlets emerge from posterior sulcus of the upper part of the medulla. So now let us see here the nucleus of tractus arterius, and you can see the spinal nucleus of the trigeminal nerve. You can see the inferior salivatory nucleus, you can see the nucleus ambiguous, all together forming the glossopharyngeal nerve. So course, as you see here, multiple rootlets move forwards in relation to the flocculus of cerebellum, joins to form the trunk, and the trunk presents two ganglia, superior ganglia and inferior ganglia. Superior ganglion is smaller, inferior ganglion is larger. Superior ganglion is not having any branch or communication, inferior ganglion is having a communication. You can also see the tympanic branch arises from the inferior ganglion. Then you can see here the sinus branches or the carotid branches which are going to the carotid body and carotid sinus, and you can see the glossopharyngeal nerve passing forwards. So we will understand this more when we are dealing with the relations. So ultimately it reaches the pharynx for its termination to take part in the pharyngeal plexus. Here you can see the tympanic branch forming tympanic plexus, then lesser petrosal nerve arising from the tympanic plexus relaying in otic ganglion, and postganglionic fibers passing through auricular temporal nerve supplying the parotid gland. So let us see in detail the course. So as I said, these rootlets pass forward below flocculus of the cerebellum towards jugular foramen, assembles to form the nerve trunk, presents two ganglia, superior and inferior. Then the nerve leaves the jugular foramen through the intermediate compartment accompanied by vagus and accessory nerves. So when it leaves, it rests on the groove of jugular tubercle of the occipital bone, passes in a separate dural sheath which separates it from the vagus and accessory nerves, and there is an additional structure which separates the glossopharyngeal nerve from vagus and spinal accessory nerve. So that is the inferior petrosal sinus. So the two ganglia, they have pseudonuclear sensory neurons. Superior ganglia, it's a detached part of the inferior ganglia. There are no branches or communications. Inferior ganglia, larger than the superior ganglia, largest in triangular depression on the undersurface of the petrous temporal. And continuing the course, the glossopharyngeal nerve passes downwards and forwards between internal jugular vein and internal carotid artery. That is, after it emerges from the jugular foramen, it passes downwards and forwards between internal jugular vein and internal carotid artery. Then it passes forwards between internal and external carotid arteries. Then it passes deep to styloid process and styloid group of muscles, winds forward along lower border and superficial surface of the stylopharyngeal muscle, and ultimately passes between superior and middle constrictors of the pharynx along with the stylopharyngeus for its terminal distribution by forming pharyngeal plexus over the buccopharyngeal fascia of the middle constrictor. So now you can see the inferior salivatory nucleus, nucleus ambiguous, solitary nucleus and spinal nucleus all contributing to the formation of the glossopharyngeal nerve. You can see the superior ganglion and inferior ganglion. From inferior ganglion you can see the tympanic branch passing through the tympanic canalicus. Then you can see the plexus ramifying here. Then it is giving rise to lesser petrosal nerve which passes through the middle cranial fossa, then foramen ovale, then relaying in otic ganglion and postganglion fibers to the parotid gland. Then after emerging from the jugular foramen, you can see it is passing between the internal jugular vein and internal carotid artery. Then it passes between the internal carotid artery and external carotid artery. Then it passes deep to the styloid process and styloid group of muscle. Then it curves in relation to the lower border and superficial surface of the stylopharyngeus, supplies it, and then passes between the superior and middle constrictor and forms the pharyngeal plexus by joining with the pharyngeal branches of the vagus and sympathetic branches. So here you can see this is the glossopharyngeal nerve. Here you can see the um, vagus nerve, and here you can see the spinal accessory nerve. You can see the relationship between among the last four cranial nerve. You can see here this is the hypoglossal nerve coming from the hypoglossal canal. Communications: inferior ganglion communicates with the superior cervical sympathetic ganglion and superior and inferior ganglion of the vagus nerve. Then trunk of the glossopharyngeal nerve joins the facial nerve by a filament which pierces posteriorly of the digastric muscle. These are the communications. Then if you see the branches, so one of the most important branches is the tympanic branch. Arises from the inferior ganglion, enters tympanic cavity through tympanic canalicus, which lies in front of jugular fossa, ramifies on promontory of the middle ear, then intermingles with the here it intermingles with the carotid tympanic nerves from sympathetic plexus around internal carotid artery and forms tympanic plexus. So branches from tympanic plexus supply mucous membrane of tympanic cavity, tympanic membrane, mastoid antrum, mastoid air cells, and most of the artery tube. It gives a branch to greater petrosal nerve of the facial nerve. Then ultimately the main contribution from this tympanic plexus is the lesser petrosal nerve, which arises from the tympanic plexus, passes through hiatus of tegment tympani of petrous temporal into the middle cranial fossa, then leaves the middle cranial fossa through foramina well or sometimes canalicus innominatus, then relays in otic ganglion. Postganglion fibers pass through auriculotemporal nerve and supply the parotid gland. The carotid branches ramify in the wall of the carotid sinus and the carotid body, joins with similar branches of vagus nerve and sympathetic nerves. So carotid nerves acts as chemoreceptors and baroreceptors to regulate heart rate and blood pressure. In pharyngeal branches, 3 to 4 in number, ramify in buccopharyngeal fascia overlying the middle constrictor of pharynx. Forms pharyngeal plexus with pharyngeal branches of vagus and superior cervical sympathetic ganglia. Then sensory branches to the mucous membrane of the pharynx. So glossopharyngeal component gives rise to, if you see out of pharyngeal plexus, there are three components. One is the glossopharyngeal, one is the vagus, the other one is the superior cervical sympathetic ganglion. Out of the three, if you see the glossopharyngeal complex or the glossopharyngeal component, that actually gives sensory branches to the mucous membrane of the pharynx. So that is why stimulation of the pharynx, the sensory component, passes through the glossopharyngeal nerve for gag reflex. In muscular branches to the stylopharyngeus muscle, which is the branchiomotor third pharyngeal arch. Then tonsillar branches supply palatine tonsil and joins with middle and posterior palatine nerves. These are nothing but the lesser palatine nerves, and they form plexus around the tonsil. So these plexus supplies the fauces, nothing but the passage between the oral cavity and oropharynx, and soft palate and tonsil. Lingual branches, two sets. Anterior set supplies valid papillae and area just in front of the sulcus terminalis. Posterior set supplies post-sulcal part of the tongue. Both sets carry general and taste sensations from posterior one third of the tongue. So if you see from anterior 2/3 in front of the valid papillae, that will be carried by the lingual nerve, general sensation, and chordae tympani nerve, taste sensation. So now clinical testing. Maybe if already the cranial nerve examination is taught in physiology, then you might be knowing this. So it can be tested by eliciting the gag reflex, that is, on tickling the posterior wall of the pharynx, soft palate or tonsillar fossa, there is a reflex contraction of the pharyngeal muscles causing gagging and retching. So retching is nothing but vomiting, like pre-vomiting. Then testing the taste sensation in the posterior one third of the tongue. These are the two ways which we can check for the intactness of the glossopharyngeal nerve. Then sometimes a bout of cough will be followed by syncope or cardiac arrest. So how this is happening is by increased pressure in the carotid sinus will through the sinus branch of the ninth nerve, that is the glossopharyngeal nerve. This will try to inhibit the cardiac center in the brainstem reflexly. This results in syncope or cardiac arrest. So as there is bout of cough, there is increased pressure in the neck region, so which gives a perception that there is high pressure within the carotid sinus. So then ultimately the compensatory mechanisms will try to reduce the blood pressure. So how they are trying to reduce is by the stimulation of the sinus branch of the glossopharyngeal nerve, which will reflexly inhibit the cardiac centers of the brainstem. Then lesions of the glossopharyngeal nerve. Actually, only the glossopharyngeal nerve involvement in isolation is very rare. Definitely, it will be always associated with the vagus nerve. So, however, if glossopharyngeal nerve is only damaged, so what will be the losses? That is the loss of taste and general sensations over the posterior one third of tongue, difficulty in swallowing, then loss of salivation from the parotid gland, and unilateral loss of the gag reflex. So, these are the things when there is a isolated lesion of the glossopharyngeal nerve. Then glossopharyngeal neuralgia, very rare, characterized by paroxysmal attacks of intractable pain in the area of the sensory distribution of the glossopharyngeal nerve. Example, throat, tongue, and ear, precipitated by swallowing. Thank you.